Ready?
Yes.
All right. So the first thing to do is get oriented, all right? So in this case, we've got apex, we've got base. Base is mostly made up of the left atrium, all right? So this is all anterior, this is posterior back here. So a couple of things to appreciate. First is the epicardium, nice shiny layer right there, mostly adipose, but also some epithelial tissue there as well. And then we can go here, myocardium, very thick muscular layer right there. Get that out of the way. Inside the heart now is the shiny white layer, which is the endocardium. Okay, those are layers of the heart. Okay, so name this layer. That's the answer that I want, whatever layer it happens to be. Okay, all right. Now we can look at some grooves. Anterior interventricular groove. Okay, posterior interventricular groove, and one I forgot to mention during lecture, but I'll add it on your list, is right here called the coronary sulcus. All right, that's on your list, and I forgot to mention in lecture, and I even forgot to mention the other three grooves.
So that's posterior?
Well, it's best seen on the posterior, but it does
Okay.
encircle the entire heart. Okay, it separates the upper atrium from the lower ventricles. A nice one though right here is the coronary sulcus or coronary groove, whichever name you want. Okay, all right, so that takes care of our grooves. Now we can look at the chambers. We have right ventricle here, left ventricle is all of this. Then we have right atrium here, left atrium is all of this that I'm touching here. Now in the animal, the atria and the auricles are really small. You can't appreciate it very well, but they are here, okay? So if we go to our right atrium, open it up, we see some nice pectinate muscles in there, okay? Nice pectinate. You guys have a heart model here?
We did borrow it.
Oh, okay. You may steal it back when you get a chance. Okay, that's pectinate muscles there. Okay, right. We do see them in the left atrium, but not as prominent. But they are here. You can see some hiding down in here. Those are also pectinates. All right. Now we can look at our vessels. Pulmonary trunk is this. Pulmonary trunk is always anterior to the much larger and thicker walled aorta. All right. So pulmonary trunk. This is aorta. Now on your specimen here, which is the first time I've seen it today, is it starts to branch and provide right and left pulmonary arteries. I would not use this for demonstration or testing, but you can see trunk is giving rise to those. You got a unique model here. I haven't seen it yet today, but there you have it, the pulmonary trunk. Now you also have here what's left of the superior vena cava, right? It's dumping now into the right atrium. Not much left of it because these have seen better days, but right there. You also then have the IVC, which is, part of it is here, okay? Because the IVC, it actually is enveloped by the pericardium, okay? So this is some pericardium here, and if I follow this in, it goes into right atrium like it should. So there's the IVC right there. Not a good one, but it's still here, all right? There you have it. The other vessels we care about are the pulmonary veins. There's an opening for one right here, right there. Again, it's going into the left atrium, so by definition, it has to be that, okay? And another one, if we get lucky, and then if we did, right there's another one into the left atrium, another pulmonary vein opening. All right, so those are our vessels. Let's do the valves. You want to hold that open for me, that'd be great. Okay, now we can go in here, and I've opened up pulmonary trunk, which we just did. We see here now there's a cusp there, there's a cusp there, there's a cusp here. They are all semi-lunar shaped, which you can appreciate, and that is the pulmonic valve. Okay, now down here we can see here a papillary muscle right there, papillary muscle there, chordae tendineae, and all this connective tissue is the tricuspid valve. All right, so papillary, chordae tendineae. I will always show a papillary muscle with attached chordae tendineae, so you know what it is. Okay, let's go to this side, and now we can see here papillary muscle, chordae tendineae, and all this is mitral valve. All right, all that white connective tissue is that. Let's go into the aorta. Now the aortic valve is difficult sometimes to see, but if you look down in that vessel, you can see aortic valve hiding down there. It's difficult sometimes to kind of get at unless you went up there like this, but even then you can't necessarily appreciate it very well. Okay? All right, so we've got the valves taken care of, and we need to see some trabeculae carneae now. I want to hold that open a little bit there more. Okay? Let's see. Let's go to the other side. I thought I saw some good ones earlier. Oh, there you have some. All that trabeculae carneae. See that crisscross arrangement? Okay, all of that. Beams of flesh is what that translates as. So big beams. Yeah.
We all wrote N yesterday.
Beam.
Oh, it's
no, beams.
She's like beams.
Oh, I thought it was beams.
Remember trabecular bone?
Yeah.
Okay, beams of bone. Okay, trabecular.
yes. Okay.
These are beams of carne is flesh. So that's what that is. Beams.
Okay.
I was like,
Yes.
that doesn't make sense. Yeah, Monica's like, I've never heard of that one.
No, the beams. Yes,
That's
beams.
what I thought it was too.
Yeah. Okay. Yeah, no, yeah. I always ask about that. Yeah. So I think that takes care of everything on here. So do you have a model I can show you the back?